Welcome to Module 7, our final module before we move on to discuss and construct the ePortfolio project for the course. In this module, we'll consider the politically and ethically controversial subject of universal health care in the United States. Since its passage in 2010, the Affordable Care Act, also known as Obamacare, has endured heated criticism as well as enthusiastic endorsement at both the federal and state levels. Clearly, the question of universal health care is a central one in this country, so it deserves careful scrutiny. For our purposes, this examination will encompass not only the ethics of universal access to health care, but also economic and political justifications for it as well. In our text, we'll study two opposed positions on the subject. The first, presented by John Gaiman, a medical doctor and bioethicist, presents the case for universal health care. Gaiman claims that an individual's health and well-being are basic human rights, and that access to health care is an instrument to guarantee that right. He then argues that the current healthcare system in the U.S. is set up to serve the interest of pharmaceutical and insurance companies, and that this focus not only destroys tens of thousands of lives, but also costs far more than a system of universal health care. Finally, with these criticisms in hand, he paints an extensive picture of what universal access to health care would look like and how it would work to solve the problems that his analysis has exposed. Taking an opposed view, Glenn Whitman, an economist with an expertise in public policy, presents an argument against publicly funded universal health care. His argument centers on a single dilemma. Should we focus on guaranteeing universal access to health care, or should we focus on guaranteeing individual freedom of choice? He suggests that the acceptance of the former imposes intolerable limits on the latter. And in a telling example, he argues that people should have the right to choose how to spend their income as well as the obligation to live with the consequences of their choice. If the choice results in sickness or death, then it's the person and not the state who is responsible. By enforcing universal health care, we're essentially making choices for people that they rightfully should be permitted to make for themselves. Whitman closes with a response to the claim that universal health care is less expensive than the current standard, showing that the situation is far more complex than ordinarily depicted. You'll notice that Gaiman's argument is clearly consequentialist or utilitarian in nature. That is, he's arguing that the central consideration in our approach to universal health care should be the achievement of the best outcome for the most people. Whitman's argument, on the other hand, is decidedly deontological or Kantian in nature. That is, he's less concerned about the outcome of the policy and more focused on ensuring that an individual's autonomous right to choose is preserved regardless of the consequences. When thinking about your own position this week, keep these theories in mind and see if their foundational principles can help guide your particular moral intuitions regarding this interesting and extremely timely problem. Best wishes for a lively discussion.